In terms of the surgical experience here at Vanderbilt, I would say this is probably second to none. I think that one of the most important things for us is that when I came here, one of the reasons that I chose to come here is because I knew that by coming to Vanderbilt Orthopaedics, I would not only learn how to operate, but I would learn how to operate correctly. And I think that that's something that can't be taken for granted.
The surgical experience here, I would say, is the best in programs in the country. You're going to get graduated autonomy that you want.
Graduated autonomy is a fairly good way of describing how you learn here. No one's going to leave you in the OR as an intern doing a procedure that you have no idea how to do. You start to work with your chief residents doing cases, and they'll take you through a case. For example, femoral nail you'll do as a fifth-year resident with your second year, and as your second year you learn how to do the start point, you learn how to put the nail up, ream the femur, while as a fifth year you're working a little bit more on the reduction and sort of final outcome.
You're going to have cases where as a junior you're there with a senior or with the attending doing those cases, with them closely helping you, assisting you, giving you tips and tricks, and then you're going to get senior level operative experiences where it's your case, you're a decision maker, and so I think that comes with a lot of responsibility, which comes along with the culture of pride and excellence. And that is the reason that we still have such a great surgical experience here.
The attendings are always sort of peripherally around during that period of time, but they're there, they're looking at your x-rays, they're commenting on your technique and available if you have any issues. But I would say that as a junior resident, a lot of your learning happens resident to resident, and then when you're one-on-one with attendings, and then as a senior resident, you get to progress along as you feel more comfortable, operate on your own, but they're always around if you need any help.
And then there's also a competition between my current second years and myself. The leader has somewhere around, I think, 50 femoral nails, and he's not even done with his trauma rotation at this point. I don't think you necessarily get that at any other place, and I'm really happy with where I am.